First of all, good afternoon and welcome to the fourth in a series of hearings of the Select Committee on Healthcare Delivery and Universal Coverage. As we dig deeper into this policy, we recognize that in order to be successful in defining a pathway to universal coverage, we must address some obvious and potential challenges related to state and federal law. For example, Medicare is funded through a protected Medicare trust fund, and federal law establishes the rules for how that money can be spent. Accessing those funds would require congressional action. There are also state constitutional issues. Prop 98 requires 40% of state general fund revenues to go to K-14 education. The GAN limits from Propositions 13 and 4 impose spending limits on the state to ensure that revenue in excess of those limits would be returned to taxpayers. If taxes were increased to fund a healthcare system, how would those revenues be affected? 3.3 million Californians get their coverage through self-insured or self-funded plans that are subject to ERISA, administered by the U.S. Department of Labor. They are exempt from the state-specific insurance regulations. Today, we have an impressive panel of experts who will walk us through these issues and more.